Hey everyone, welcome back to my channel. Today I'm diving into a really important topic that affects both patients and healthcare providers. Why do so many people experience delays in getting diagnosed with chronic respiratory disease like COPD, asthma, or pulmonary fibrosis? If you ever thought breathlessness is just getting older, or if you're a healthcare professional who's seen patients slip through the cracks, this video is for you. For the public, this matters because earlier you know, the sooner you can take control of your health. For healthcare professional, it matters because late or misdiagnosis can lead to worse outcomes, higher cost, and frustrated patients. Did you know that many people wait for months or even years before receiving the correct diagnosis for chronic respiratory disease? And during the time, their condition might silently worsen, their quality of life drops, and treatment becomes less effective. So, what's going wrong? Let's break it down. For patients, delays often start with misunderstood symptoms. For example, breathlessness. Oh, I'm just out of shape. A nagging cough. It's just my smoking habit. Fatigue, maybe I'm just stressed. This is called symptom misattribution, and it's one of the biggest culprits. Added to that, stigma, like I don't want to be blamed for smoking, fear of diagnosis, being labeled with different disease labels, cultural beliefs that prioritizes home remedies, gender differences where women's symptoms may be dismissed and men may underreport their breathlessness. And mental health barriers like anxiety, denial, depression, all of these keep people from seeking help early. Even when patients do seek help, the system itself can slow things down. For example, in primary care, short appointments means there isn't always a time for thorough checks. Tests like spirometry, crucial for diagnosing COPD, are often underused. Referral delays and long wait times for specialists can stretch out the process. Another truth is services are fragmented. Respiratory care, mental health, primary care often don't talk to each other. And rural or underdeserved communities face geographical inequities like fewer services, longer travel, and more barriers. When we look into the clinician related factors, doctors and healthcare providers can also unintentionally contribute to delays. Symptoms like chronic cough or mild breathlessness are sometimes misdiagnosed as asthma, infection, or even anxiety. Biases play a role, attributing symptoms to lifestyle, dismissing younger patients, overlooking women or minority groups. And many primary care clinicians report lacking confidence in interpreting spirometry. Sometimes, instead of confirming the diagnosis, inhalers are prescribed on a trial basis. This can mask the disease progression without addressing the root cause. When we look into the disease-related factor itself, respiratory disease themselves can be tricky due to its nature of gradual onsets, like COPD, interstitial lung disease, and asthma often develop slowly, making early signs easy to miss. And symptom overlap is another factor. Breathlessness and fatigue can mimic heart disease, obesity, or depression. And intermittent symptoms can be missed, like asthma flare-ups may lead people to dismiss them as not serious. And more importantly, did you know who you are and where you live matters for your early diagnosis of chronic respiratory disease? Yes, it's true. Socioeconomic deprivation often means higher smoking rates, less access to healthcare, and later presentation. And ethnicity can be linked with language barriers, diagnostic overshadowing, and unequal access to care. Age plays a role too. Older adults normalize breathlessness as just aging, while younger patients may be told they are too young to have COPD or chronic disease. And here's where the evidence gets more powerful. A multi-center study on pulmonary fibrosis showed that the average diagnostic delay is 2.1 years. Men waited longer because of patient-related delays, while older adults face more system-related delays. A UK survey of 398 patients with COPD, interstitial lung disease, asthma, and bronchitis found that lack of disease knowledge was a key driver of delay. 34% of COPD patients didn't recognize their symptoms. 74.6% of the interstitial lung disease patients had never even heard of the disease before diagnosis. And a third of bronchitis patients said the delay was due to healthcare professionals' lack of expertise. Another evidence from a retrospective UK study in the Lancet Respiratory Medicine tracked 20 years of clinical data. It revealed that 85% of the patients had consulted for lower respiratory symptoms in the 5 years before diagnosis, yet were still diagnosed late, pointing toward the systemic missed opportunities despite frequent consultation. And there is more evidence. A focused review on COPD diagnostic delays identified them as multifactorial, driven by healthcare provider knowledge gaps and patient related delays and disease heterogeneity. It concluded that raising awareness, the clinical awareness for using spirometry for smokers aged 40 plus, is critical to improve timely diagnosis. Another evidence from an integrative primary care study showed that diagnostic delays correlate strongly with missed diagnostic opportunity. Patients with longer delays had greater symptom burden and disease severity. Importantly, it suggested that diagnostic inertia, not just patient delay, is a significant barrier and identified clinical phenotypes to guide risk stratification and proactive diagnosis. I wanted you to become aware of this Arctic cohort study, which demonstrated that early diagnosis of COPD is tied to significantly fewer exacerbations, lower comorbidity, and reduced healthcare utilization compared to late diagnosis, underscoring the tangible benefits of early detection. It's interesting to note a UK cohort study involving greater than 150,000 patients found that presenting with breathlessness was associated with elevated long-term risk of diagnosis for COPD, asthma, or ischemic heart disease. Notably, one-third received diagnosis over 6 months after the initial symptom, and 10% were diagnosed more than 3 years later, emphasizing a missed opportunity for early investigation. Now, with a GP focus, there is a qualitative research which shows that some GPs intentionally delay diagnosis, worrying that telling patients too soon could harm their mental health, despite patient perceived values of intervention such as smoking cessation advice. And last but not the least, there is another study which focused on evaluating the underdiagnosis in primary care. Reviews stemming from the DIMCA study highlighted that many patients don't present symptoms or are reluctant to embrace their patient role, contributing to underdiagnosis of asthma and COPD. It called for proactive case finding paired with understanding patient values to improve early detection. So, in summary, delays in chronic respiratory disease diagnosis are multifactorial, shaped by patient perceptions, clinician biases, systemic inefficiencies, and the insidious nature of the disease themselves. So, reducing delays requires awareness campaigns, earlier spirometry use, culturally attuned communication, and integrated care models with a psychologically tailored intervention. So, what's the takeaway for the public? Don't ignore persistent breathlessness, cough, or fatigue. Speak to your doctor and ask your lung testing like spirometry. And if you're struggling with anxiety or depression with your breathlessness challenges, please do ask for a psychotherapist or a psychology referral. For healthcare professionals, listen carefully to your patients. Don't dismiss subtle symptoms and use early testing when possible. Because every month lost in diagnosis is a month where treatment and support could make real difference. Thanks for watching and staying with me until the end of this video. If you found this video helpful and informative, give it a thumbs up and share it with friends or colleagues, and subscribe for more insights into respiratory health and mind-body medicine. And I love to hear from you both, the public and the healthcare professionals. Have you or your patients experienced delays in diagnosis? What made the biggest difference in finally getting answers? Drop your thoughts in the comments and let's keep the conversation going. Remember, breathing is life. Let's not take it for granted because timely diagnosis and bridging specialties can change lives. Until my next video, stay curious, stay healthy. Signing off, Devi Sundar.